At the moment we're going through a period of real unprecedented times in terms of new treatments for cancer. The whole way that we think about cancer treatment is changing now, and we hope that in the future outcomes for patients are going to be much better. Ambulatory care is a new model for patient treatment. The idea of an ambulatory care unit is that we can now give the patients the same treatment, but they can keep their independence by either staying at home, or if they live a long way away from the hospital, they can come and stay in flat accommodation on the hospital site. This means that patients are much more independent. They're given much more freedom in what they do during the day when they're not receiving their chemotherapy treatment. It's better for them because they're physically stronger, they're exercising more, which is really important. And our experience with this is that this is transforming patient care in a very positive way. So patients are getting through the treatment much more safely, and their experience of the treatment is much better than it used to be.
We offer a variety of treatment pathways that may include a bone marrow transplant, it may include a chemotherapy regime, so a general routine for most patients will differ from treatment to treatment and patient to patient. This would be something we would discuss with you on a day-to-day basis, and treatment dictates what times that may be, but often you may find that these can be lengthy days, often 9 until 5, 9 until 6 p.m. at night. So it's to consider the travel implications during perhaps busier times and how that may work with carers that are supporting you. So some of the things that we ask you to think about when having ambulatory care are some of the safety aspects of having treatment in an outpatient setting. So some of these things will be around things you may already be used to, so things like the triaging process for out of hours, so that's monitoring your symptoms at home, things like taking your temperature, monitoring your diet and how much you're being able to drink, symptoms that may not be controlled with medication that you've been given to control things like sickness or for an upset stomach, for example. So we're still asking you to remain vigilant with symptom monitoring out of hospital whilst you're not under our care.
Every single patient at the moment who's staying in a hospital bed, we should be looking to see if we can adapt the ambulatory care model so everyone can be looked after in this way. We have found there are enormous advantages for patients by being looked after in ambulatory care. One of them is that physically you're going to be much more mobile, you will naturally be moving around more, you'll be exercising more, and there's very strong medical evidence that this is really important. Secondly, your diet will be much better, it'll be much more normal for you, you will be in control of when you eat and what you eat, and this is much better for you. We've become much more aware over the last few years about the importance of receiving treatment with good normal diet. And then the third thing is that psychologically and emotionally, we're finding that patients who are looked after in this way just feel normal, they feel themselves, and they're finding that they're coping with the treatment that they're having much better by having ambulatory care.